and concerning developments. So these days, most conflict actors, when they perpetrate violence against healthcare, will at best deny that they are responsible for this. And in the worst case scenario, we find absolutely bizarre description of supposedly faked events, staged events, and a lot of the conflicts these days, as we all know, no longer just play out with weapons on the ground, but they also happen in the media and social media. And I think as one of the results that has happened because of the greater concern and the greater attention to attacks on healthcare is that the very stories around attacks on healthcare are also becoming a weapon in this media and social media wars. And that is a very concerning issue. And I think this is something everyone should be aware of, because when we hear stories, we may sometimes hear a very distorted version of what has really happened. And on this, I'll stop and I look forward to our discussions later. Thank you.
Thank you, Christina, for once again bringing the data and really starkly, including just in the last few weeks. And thank you for bringing our attention to the crisis in Nagorno-Karabakh and also in Cameroon, and some of these areas that in the context of the current situation for people in the United States who have been so focused on what's going on right here, it's challenging but critical for us to pay attention to other places that seem far away but are actually very, very close in so many ways. Last but not least, on this panel, we'll zero in on the situation in Syria, which Christina, you alluded to. PHR considers this country to have experienced the most intentional and systematic assault on healthcare facilities and personnel in our 35 years of operating. It effectively constitutes crimes against humanity in our view. Dr. Muffadal Hamadeh is president of the Syrian American Medical Society since July 2019, but he's long been associated with SAMS. SAMS has been a constant partner and ally of Physicians for Human Rights during the past decade of the horrific conflict in Syria. He's an oncologist who was also chair of SAM's Lebanon Relief Committee and has led more than 10 medical missions to treat Syrian refugees in Lebanon. We heard about Yemen, nearby country with also a very high toll on health facilities and personnel during the breakout sessions. And now it's important for us to focus on Syria. So over to you, Mufaddal.
Thank you. So I don't know if you can see me well, okay, or hear me. I apologize for the background noise. All right, can't control. So my mission is within 8 minutes to describe to the medical students in this on this meeting, what does it mean to be a doctor in Syria now? So for most of you who heard about the conflict in Syria, I'll just summarize it in 2 or 3 words as much as I can. I mean, Syria started a revolution about 10 years ago. As a result, the country went into war, and many other forces from outside Syria came in, the Iranian, the Russians and everything, and the country was divided to many areas under different controls of some areas under the government control, some areas under the rebels control. And since then, you know, the medical personnel has in Syria, particularly doctors, have gone through many challenges during that period of time. We here in the United States live in sort of a bubble, different from the rest of the world, because we have everything available to us when it comes to medical treatments and our ability to deliver care in the most sophisticated and advanced way. For instance, I'm an oncologist, and many of our drugs are worth over $50,000 a month. Speaking about an area of conflict, an area under bombardment, that kind of a care is impossible to deliver. The fact that we have many medical students here on this meeting is a great sign, because quite honestly, the fact that many of you are associated with Physicians for Human Rights, that means you are in medicine, in the medical field, for the right way, for the right reason. And you cannot be completing your journey as a medical professional without knowing what the rest of the world is going through, and knowing the other side of medicine, which is the humanitarian side, that where you're going to be able to deliver medical care for people who have nothing, and basically for free, not for profit. And that's what is the essence of the soul of medicine. So as I said, in the Syrian conflict, and Susannah mentioned that it is a conflict where providing medical services is considered criminal. It's criminalized. And if you are a medical professional and providing medical care to anyone who opposes the government, or an area that is opposed to the government, that's a criminal act. And you deserve to die in the eyes of the government, and in the eyes of many of the people in the conflict area. So your hospitals, your clinics, everything is a legit target. They don't have a problem saying that, and they don't have a problem in some of their media admitting that you are a criminal for providing medical care. So many of the healthcare workers in Syria face many challenges, as I said, including stress and trauma. Imagine you're in a hospital where you are being attacked day and night with bombs and airstrikes and artillery, and you don't know if you're coming back home or not. And many of the healthcare professionals kiss their families goodbye, go into their work, not knowing that they're going to see them again. In 2020 alone, 25 attacks on healthcare facilities were recorded. 18 healthcare personnel were killed or injured. In 2019, 67 attacks with 24 killed or injured. These injuries that happen to people in those hospitals are basically, many of them are physical and many of them are psychological and stress related. As a result, we've seen many of stress and depression and anxiety seen in the medical health professionals. We see a lot of them have to worry not only about themselves, also about providing to their families and parents. And under these circumstances, we've seen a lot of survival complex syndrome. We've experienced, many of them have experienced detention, torture, and PTSD is another major factor there. There has been a lot of pressures from their communities also when it comes to their ability to provide, not expose their families to danger as they go to work as a healthcare facility. Usually it's known in Syria in some areas that the most dangerous area in the city is a hospital and clinic. And by moving a hospital or clinic to an area or a city in Idlib or area under the government control, or any other area that is outside the government control, exposes the whole city for retaliation, bombardment, and destruction. So another challenge is also the lack of access to training and equipment. Many of these doctors have been out of training for a while. They don't speak English very well. They don't have access to teaching materials, and they don't have access to conferences and the things that we usually have easily available to us here in terms of continuing medical care. Many hospitals don't have oxygen. They don't have electricity. They don't have diesel. I talked about oncology in particular, biopsies, pathologies, special staining, diagnosis of cancer is not available. No ICU beds, no cardiovascular services, cardiac cath, no neurosurgery, limited incubators for newborns. Very difficult referral system. A lot of those patients can't go anywhere because they're trapped, and a lot of them are left to die. Now, we have talked about the challenge of COVID. We've seen how COVID has been a major stress for doctors in the US. And many of us, some of us talked about it today. We've seen what it means for the doctors and nurses and healthcare professionals to be able to stand up for COVID and help the community at large in fighting the COVID pandemic. We have seen how here, when the politicians failed, the scientists and the doctors came through and saved humanity and came up with the vaccine in order to provide relief and a cure from this disease from everybody. We've seen how much stress it took on us. Imagine now you're in Idlib, where you have very limited facilities, and under the other circumstances with with hospitals that had been bombarded with a stressed out staff. Now you have a lot more COVID cases, and you have to fight it back, knowing that the healthcare professionals are at the highest risk of contracting COVID. So we were lucky in the northwest Syria, where the area outside the government-controlled area. We only seen COVID come up. The first case was discovered in July. We thought that we're going to be okay, but actually that was a false dream. So far, we had 13,000 cases in that area with only limited testing, 47,000 tests, 110 deaths so far. Cases among the healthcare professionals are 2,000 cases. That's way too much, 14%. And luckily, the people in the camp, the IDPs, are only 8% of all the total population. I don't understand that. I thought the people in the IDPs and the displaced in the camps are more vulnerable than others. But actually, so far, we only have 88% of these cases. Of course, we have developed SAMS. It provides about 50% of medical needs in that area. And we have so far been able to create three COVID hospitals with a capacity of 90 ventilators and about 210 beds in those three hospitals. We have a 57% occupancy of ICU beds so far. By American standards, COVID is not as prevalent here as it is here in the US and other areas so far, but we expect it to get much worse down the line. What are the main gaps? Mainly funding, PPEs, and very limited testing is available. Medications is a main source of anxiety because we don't have enough medications. As I said, we only have 10 ventilators, 90 ventilators and 90 ICU beds. If things go worse, we can't be able to get more people in there. What is SAMS doing to help people in fight COVID in Syria? Basically, we are training many of them. We had about 80 training sessions in Arabic attended by many of our doctors inside Syria. Our doctors here in the US are the best and the most trained and most experienced in fighting COVID. So they were able to provide their experience to their colleagues in Syria and help them out in that regard. Also, we were able to do telehealth ICU. Many of our doctors are actually taking care of patients using the telehealth technology, and we're providing doctors with helps and advice and of course funding so they can be able to provide their patients treatment. So how can students help? We can talk about later with a Q&A questions, but basically we can talk about students volunteering in medical missions and what it means for a medical student and young doctors to be on medical missions and supporting volunteering and research. We have great data in SAMS that in a very unique situation, providing healthcare services in underserved areas. So we can talk about that later. I'm sorry, I may have gone over time, but I'll stop there.
Thank you, Mufaddal. Really want to salute the courage of you and so many of your colleagues at SAMS over the years, many who've actually risked their lives coming from a country here where they don't have to do that. to help your fellow Syrians, and the crisis continues. As you've seen from this presentation, the already decimated healthcare system in Syria after 10 years of war with intentional attacks and systemic attacks on the health system has now been exacerbated by the threat everywhere of COVID. And PHR is in the middle of a study right now that will look at the challenges in the southern part of Syria, the so-called reconciled areas that were formerly centers of the revolution, now taken over by the government, where we fear that there's not only a lack of transparency about COVID data and health data, but also discrimination on a political basis. So this whole panel has presented quite a grim scenario, and we worry at PHR that the kinds of attacks that Christina described against healthcare workers by members of civil society who basically can see health professionals, and maybe especially nurses, as not only vectors of the disease, but the villains who were failing to give them the care that they so desperately want and need, or preventing them from being with their loved ones in health facilities. And with the vaccine rolling out, this challenge in an environment which will likely include fear, suspicion, mistrust, and shortages is likely to increase. So we want to talk about what we can do, but we also want to take any questions that you have for this extraordinary, knowledgeable panel. And while we're here, I also want to introduce one of my newest colleagues at PHR, Dr. Hussam Al-Nahas, who is an incredible, courageous doctor from Syria, who spent the last year getting his MPH at the Hopkins Bloomberg School of Public Health, and who has lived through the conflict, desperately treating injured patients and experiencing the attacks on health personally in Aleppo and elsewhere. So Hussam, if you want to add anything while we're waiting for questions to appear in the chat, please, comments, questions, anybody, don't be afraid, post them in the chat. And Hussam, welcome, and thank you for joining us.
Thank you very much, Susannah, for the introduction. Can you hear me well?
Yes, we can.
Okay. Thank you very much for the introduction again. I'm so happy to join the PHR and be part of the team. My name is Hussam Al-Nahas. I'm a physician by training. I lived in Syria between 2012 and 2014, where I was a medical student. And part of my story is that I got arrested for two things: having a student ID as a physician or as a medical student, and have a blood spot over my pant from a patient who I treated before going to the checkpoint. And my entire time in the prison and the torturing sessions were all about questioning me and asking me, who are the other doctors you were working with? I lived through the conflict, and I witnessed some horrible things that happened to anyone, including doctors or medical students, who tried to help protesters get access to safe healthcare. After hearing about people who were arrested from the hospital, from the EDs, because they were suspected protesters, going to jail, even killed, we couldn't, as medical students even, we couldn't just watch what was happening. We wanted to get more involved and fulfill our duty as a future physicians to help others. Some of our colleagues through the way were arrested, killed under torture, and even burned, and sent to us as a message that this will be the fate of whoever tried to help protesters. And this is why I have now the passion to work more as a physician on advocating for human rights and document the human rights violations that was committed inside Syria against healthcare providers and healthcare facilities. So thank you again, Susannah, for the introduction. Thank you for giving me the honor to be part of the team, and I'm happy also to participate in answering any question.
Sure. Thank you, Hossam, and thanks for being with us today on very, very short notice. I invited him yesterday. But we have a question that's come up, and it's from Tom Griffiths. Would you like to unmute and pose a question yourself, Tom?
Hello. Again, it's a continuity of this morning's discussions and what you're explaining here about the rising levels of violence against healthcare workers. My question is, to what extent are healthcare systems and their organizations' managerial priorities or financial priorities in itself a psychological threat against both their patients and their healthcare staff? And if that is the circumstances, what allies can staff approach to in such circumstances if feel under such a threat? So it's two questions combined.
Anybody on the panel want to tackle that to start with? Hani, do you have some thoughts about that? No?
Susannah.
Oh, go ahead, Hani.
Okay. So that is a very set of questions. So clearly, if people feel that their institution is not supporting them, it's particularly challenging because then they feel beset kind of on all sides. And I think the allies that healthcare staff turn to are frequently the public at large, either directly through kind of public appeals. People certainly have all kinds of outreach now with social media, but also through respected organizations like PHR, like Amnesty International, like Human Rights Watch, where people are able to kind of make their plight known. Frequently, they can do that anonymously, but then rely on kind of the moral strength of those organizations to raise the issue either to their institution or to the public.
I will say that one thing Physicians for Human Rights did back in the spring when we started to see all of the reports and actually receive emails, some of them actually anonymous, from healthcare workers on front lines who were being threatened by their own institutions right here in the United States. Some of them major leading academic centers where they were being threatened for calling out the unsafe conditions or demanding PPE or refusing to wear the same mask over and over and over again, or trying to bring in their own PPE, which they had acquired independently, and the hospital said, no, you're not allowed to do that. You have to use ours, and you have to use the same one over and over again. And so we organized across a number of health professional associations, including the American Nurses Association, the American Public Health Association, the National Medical Association, and a number of others, to put out a call to hospital administrators, but also to political leaders, including governors, to say this is unacceptable and healthcare workers need to be protected. So I think, and this answers another question which we have on the chat, which I'll move to as well, from I think Rebecca left. What can students do? And one of the first things, and I think this is evident from all of the information that has been shared here, is we need to educate ourselves, and we need to share the information within healthcare institutions, whether they're medical schools or university hospitals or clinics, so that people are aware of this problem, and we need to call it out. As we heard last night and in the morning, make noise. So first is exposing the problem and understanding the problem. The next thing that needs to be done, though, is organized advocacy. And Rebecca, do you want to ask your question, which is along those lines, I think, but also about how do we do it for places that are far away?
Yeah, thanks, Susannah. So, I wanted to kind of build off the discussion that was had and to ask how medical students can be involved in supporting physicians in conflict zones, and specifically in Syria and the Middle East region. And to sort of frame it as, I think from the medical student perspective, it's often difficult to understand, how we can have an impact because we are still learning medicine and we're all very conscious of the limited skills that we have and wanting to give, but also not wanting to overstep. So I think, thoughts on, what we should do with those parameters.
Very good question. And I'm sure we have a number of answers here, but maybe either Hossam, you could answer. Well, first of all, let's go to Dr. Mufaddal first, because maybe you can tell us how through SAMS medical students get involved, or how they prepare themselves to get involved later once they get all the credentials.
We actually have a couple of medical student chapters in SAMS. We would like to nurture and mentor medical students. Personally, I insist every time I go on a medical mission that I have several medical students with me. Most of all, SAMS is an organization that is very interested not on only providing medical relief, but providing research and education. We believe that medical missions and being able to participate in some of these missions and see the conditions on the ground are extremely important to prepare a medical student for a future life of a physician wherever you're going to be practicing. It makes you a much better physician down the line. It makes you a lot more compassionate. It gives you a different perspective on how what the true medicine is, what is how you practice medicine in areas outside your own environment, how you connect to other people. We think this is a great service to our society. We bring back this medical student to our communities so he can be a better physician down the line. That's a very important part of the training. We insist on when we are on staff in hospitals that have training programs, that we give lectures on what it means to volunteer and to be a volunteer physician. That is extremely important for your profession as a physician down the line. So it is by participating in medical missions to know what it means to be a physician down the line. In terms of advocacy, we believe medical students have been a great advocate to refugees and refugee rights. As they come back home, they actually are relaying the message. They are our biggest advocates for human rights and for refugees and the rights of refugees. So they are increasing awareness, increasing with that. And then I know a lot of medical students like to do research or like to participate in research. SAMS has a tremendous amount of data in terms of healthcare facilities and all the things, all the practicing medicine and in different areas, conflict zone areas. We have many papers now that we're producing, and many medical students would like to participate and see this data, preparing and learning.
Great, and thank you, Dr. Mufaddal. And we can maybe post in the chat how people can reach out, students can reach out for that. Physicians for Human Rights also uses medical students for research, not only for our asylum work, but for some of the international work, including on countries where we have attacks on health. Christina mentioned that she has an answer to this question as well, Rebecca. So over to Christina.
Yeah, hi, thanks, Rebecca, for this very useful question. There is a lot that can be done remotely. So in case anyone is interested, you can also get in touch with us. We monitor situations. For example, we started monitoring what's been happening in the Tigray region in Ethiopia at the moment, and we certainly looked at Nagorno-Karabakh a few weeks ago. So these things are happening all the time, and this is all done online remotely. So if anyone is interested in contributing to this and then bringing these issues to a wider global audience, there's a lot you can do.
Can you post in the chat, Christina, how to reach Insecurity Insight if they're interested as well?
Yeah, I'll do that.
That would be great. And thank you for that. Any other questions or comments? I'm curious, Hani, and if you have anything to add, or also Hossam, since you were, in Syria as a medical resident and certainly student as well, and now you've been at Hopkins, do you have any views on what students can do here to help others there? Like, what have you seen or thought of from your experience that might be effective?
So yeah, you're right. As a medical student, I've been working. Like, I had worked in Syria for 2 years, and I was a medical student. And what Rebecca mentioned, that although as a student you might expect to have limited knowledge or limited capacities, but don't fall in under this notion, because when you have the opportunity to help, you will be surprised with the amount that you can help with. I remember my first ever published publication and my first ever research was done with Dr. Hani and a medical student who was helping him. And it was a great experience. Maybe you might not notice this, but the education system, the medical education system is very different in Syria comparing to the US. So even as a medical student, trying to network with medical students in Syria, providing them, like building their capacity, helping them understand different aspects of medicine, the evidence-based medicine, and helping them access information they would usually not have access to, would really help. Again, as a medical student, I worked with many experts from around the world to design the Syrian protocol to respond to chemical attacks. And I was a medical student working on this. But without help from people across the globe, there was no way I could do it alone. So yeah, participate with SAMS and other organizations who have and who can help you build network inside Syria with other physicians or medical students inside Syria. And you will find a lot of opportunity, and you will find a lot of people who are keen to collaborate with people from outside and are willing to learn more.
Thank you so much, Hassan. We have maybe 2 more minutes. Thank you for being generous, our host, Sebastian, to give us a couple more minutes, and then we'll wrap up, give people a little break before our next session. Is that right? Is that where we are?
And yes.
Checking.
And somebody has their hand raised on this,
good.
Mohammed.
Okay.
So feel free to speak up, Mohammed.
Yes, thank you, Sebastian. Actually, I don't have a question. I have a comment regarding these interactions and these discussions. Actually, I'm a medical student from Palestine and from Gaza Strip, to be more specific. And I was encouraged by these transparent and motivating discussions taking place to initiate a national chapter here in my country to take our roles as medical students to the next level regarding human rights and fulfilling more tasks as active citizens in the community. So yes, this is my comment regarding this, and thank you all for this amazing discussion. Thank you.
Thank you so much, Mohammed, and welcome. Also, just letting you know that in the Safeguarding Health and Conflict Coalition, we have groups who are part of the coalition working on the crises in Palestine and Israel's occupied territories, Gaza, etc. And so you might check the website of Safeguarding Health Coalition as well to get engaged locally. BHR, by the way, we don't have regular chapters. We have sort of student chapters at medical schools so far. We don't have chapters of the organization. We just never organized that way, just to be clear with people, but we have a big global network that's growing, and we would love people to get engaged in any way you can. We also have regular opportunities for action on all of the issues pretty much that we've been discussing today. So that's why at the very beginning of this morning, I encourage people to actually join PHR, as well as through the Student Advisory Board and the chapter and the student program of PHR. So thank you for your engagement. Unless there is any other comment or question. And I see Rebecca has also connected with Mohammed. That's great. That's what this is all about. We don't have coffee hours in person where people can do these chats, but I know that people have connected today. So I'm going to close this session out, and thank you to our wonderful speakers. I'm giving you a virtual applause. People can unmute and clap. she can hear you. That would be so cool. We're very limited in hearing the group, but let's do an applause for everybody, because this is my goodbye to you at this conference. I know there's a lot more ahead, which I'm going to listen to, but let's give a big round of applause to our coordinators, our hosts, our speakers, and all of you who have taken this Saturday. Pat yourselves on the back and onward.